So, Namaskar everyone. My name is Dr. Manish Yadav, and welcome back to my YouTube channel. In this entire series, we are trying to touch various aspects of literatures, especially old literatures like Kant, Boger, BBCR, Clark. We'll try to explore more and more. But specifically in this talk, in the playlist that you have entered right now, the name is Techniques of Prescribing. And there's something interesting while I was reading Kent's lesser writing, I came across very interesting about what Kent says about technique of prescribing. From there, this idea came that along with the philosophical sharing knowledge, why shouldn't I start sharing you some cases? So this entire play store, or sorry, the playlist that you have entered, you will find techniques of prescribing. And I'll be coming back and sharing few very small cases in everyday's practice. Of course, all the cases whose I have got good follow-ups, I'll be sharing with you, and let us learn from cases, because learning from cases is the best thing that you can do. So technique of prescribing, on that I will be focusing, and let us see how and what we can learn from this. So let me share you my first case in this sequence. So techniques of prescribing. There's something very nice written in Kent's lesser writing, page number 200. He writes, it is doubtful if the technique of prescribing has made much progress. It is doubtful that technique of prescribing has made much progress. It is in this direction that all need to most to meditate. So when he wrote about meditate, technique of prescribing, I started thinking, what is it trying to say? And then it clicked to me that actually he's talking about that we have to share and learn and equip ourselves and develop our skills of techniques of prescribing. There is different ways we can prescribe a remedy. So that has to be learned. So I will go forward and start talking about technique of prescribing. Different cases I'll come along. This is my first case which I am coming around. And these are all recent cases which I have been curing in my practice. Now, I had a phone call. It's a distance patient, one of my relatives actually. She's pregnant. And problem, it's her first pregnancy, and uncontrolled vomiting started. Gradually, right now it's fourth month, I think. Yeah, fourth month. But after 1 month, like second month, as she went, little vomiting started and the intensity increased. And a lot of anxiety, a lot of vomiting started. And of course, they were taking allopathic medications also in between, but those medicines were not helping. In fact, they were causing more trouble. In fact, in one of the episodes when she took the antiemetic and antacid and other things, she got constipated, some bleeding in the piles, rectum started, a lot of complications started. So she was unbearable for her to use any allopathic medications also. That's how she called me, and I struggled. I literally struggled in this case because every day I was doing a follow-up, almost every day, on first day, second day, and I was changing so many remedies. So let us see how I got breakthrough in this case. 24 years female, first pregnancy. Vomiting started gradually since the second month of pregnancy. What were the symptoms? Vomiting, eating, and drinking after. And whenever she called me up, she would only say this, yeah, I'm getting vomiting. Whenever I drink anything or I eat, I have to vomit. I can't retain anything in my stomach. Gradually, vomiting and nausea became worse. Now, few remedies I had already used. Cocculus, Pulsatilla, Nux, etc. Few more of them, rather. I tried, but all remedies, gave very partial relief, very partial relief. So when you change a lot of remedies and things are not happening, you try to find out what is the remedy for the disposition, the constitution remedy. And the constitutional remedy that I understood about this lady was, she was absolutely pulsatilla. Pulsatilla, from general point of view, mental point of view, the craving and aversion, even the vomiting and nausea symptoms, whenever I used to repertorize, pulsatilla would always come forward. Everything was matching. In fact, out of all the remedies that I used, like Cocculus, Pulse, Nux, and a few more I used, I think I don't remember, but 3, 4 remedies more I used. Out of that, only pulsatilla was the remedy which actually gave her relief. But the problem with pulsatilla was, though it was matching everything, it was the best remedy that gave partial relief, but it was not holding on. Like I would give pulsatilla 2 days, she's better. Then third day again vomiting starts. With pulsatilla, other symptoms are going down, but this vomiting was not going much, and that's how I was struggling. So this was the remedy which acted best, but it was partially acting, not much relief in terms of vomiting, but it did help in her. There was a lot of emotional turmoil, as I said. Pulsatilla, like all symptoms, so I don't want to go into what pulsatilla is, how it, what are its emotional symptoms. Now, what to do? Vomiting and nausea persisted, and I'm getting calls. I'm also, because see, every homeopath wants to treat, right? I'm trying. I'm thinking, which are the remedies? I'm reading other remedies. This, that, nothing is matching. And then what I did is, I took more symptoms. Like she had vomiting at the sight of food. It is increasing. So only best thing that I could get is she would say only one thing: vomiting at the sight of food, vomiting when I eat, I have to vomit. Morning when I get up, I drink anything, I vomit. Anytime I drink, I vomit. I eat, I vomit. She's not eating. Now this is very troublesome, right? She's pregnant, first pregnancy, and because of vomiting, she's not able to eat. If she's not able to eat, what nutrition she is going to get? So this was getting very scary actually. So what I did is I took different repertories. And here in technique of prescribing, this very important thing is many times symptom is in front of you. We always want to look for symptoms. But what is happening inside the body? We don't know. Now, ideally, I was thinking that we should do an endoscopy. Like if she was not a pregnant lady, I would have rather in this case, I would have advised that please go and do endoscopy. Let me see what is there inside. But I can't suggest her, right now. And I'm thinking, maybe I'm assuming what could be the cause of vomiting in pregnancy. I'm reading physiology, pathology, all those things I'm reading and trying to find out some remedy which matches that. But the real thinking process, sometime in these kinds of, what do you say, one-sided disease, you get repertory into your activity, and repertory helps. So I read many repertories. I started looking at all the sub-rubrics of Kent, Boger, Bonninghausen. Nair is one of the repertory. Nair is one of the repertory which actually is very less used, but it is not used for making totality. It is not used for making totality. Whenever I have got stuck in some kind of chronic cases, I've used Nair brilliantly and I've got some wonderful results from Nair repertory. So what I did is, let me just go to the Nair repertory and show you exactly what I did. So let me share. Okay. So if you see here, maybe I can just zoom in. Yeah. I go to Nair repertory. I go to pregnancy. There's a pregnancy chapter in there. You go to pregnancy. I put vomiting. And I started reading all the subrubrics, all, trying to match if something matches like that. With pelvic viscera congestion, frequent severe attack, first food, then mucus, finally bloating morning, later in the half, no. And then I came to this rubric. Long continued cannot retain food on stomach. Long continued cannot retain food on stomach. And then it clicked to me, oh my God, Calibicrome is a very good remedy for stomach ulcer. The pathophysiology, what Calibicrome does is destruction of mucous membrane. So let me show you now. So I went into Mater Medica, and then looking into Mater Medica, you go to stomach, Calibicrome, and you see here what is written. Gastritis, round ulcers of stomach. And there's somewhere it is written vomiting of pregnancy. Okay, I'll show you. But this was the pathology, right? Round ulcers. And you see a lot of ulceration in this remedy. Internal, especially mucous membrane, nose, eyes, and gastritis. So she was actually suffering from gastritis. This was a very severe form of gastritis because of which the vomiting was happening. Now I understood that why my other remedies were not acting, because my remedies were not covering the pathophysiology, the pathogenesis, that we talk about. And how important is to understand what is happening inside the tissue body. Let me go back. So this was the rubric. Pregnancy long continued, cannot retain food on stomach. And there's only one remedy, Kali Bikram 3 mark. Now, if you have heard my Kent lecture, first lecture, where I'm trying to explain Kent's philosophy and where he talks about generalization and how to make totality, there also I've said that single drug rubrics are like two-edged sword. Two-edged sword. You have to use it very carefully. You cannot get excited just because you find that symptom matching to your patient. The remedy has to be studied from Matra Medica and washed out. Okay. Now go back. This I showed you. Yeah, it's there in female. Okay. Vomiting of pregnancy. Fatak. It is given in Fatak if you open vomiting of pregnancy. You want to hear the audio? Yeah, you can hear.
मैं 12 भैया।
आराम है अभी?
हाँ हाँ
अभी खाना वाना खा पा रही हूँ?
हाँ हाँ भूख भी लग रही है और खाना भी खा ले रहे हैं।
अच्छा। ये
हाँ
अभी आपको जो वॉमिटिंग चल रहा था, ये अभी तीसरा महीना चल रहा है ना, तो चौथा महीना?
नहीं, चौथा पूरा होने वाला है, बस 1 हफ्ता और बचा है।
अच्छा, ये वॉमिटिंग आपका कब चालू हुआ था, कौन से महीने में प्रेगनेंसी के?
भैया दूसरे के लास्ट महीने मतलब दूसरे के लास्ट जब हुआ तब वही चालू हुआ।
लास्ट महीने।
हाँ फिर तीसरे में तो थोड़ा बहुत होता था।
लास्ट में
फिर
बढ़ गया था ना, 15-20 दिन में ज्यादा बढ़ गया।
हाँ बहुत ज्यादा बढ़ गया, फिर चौथे में भी वही फिर शुरू हो गया ज्यादा।
ठीक है, अभी रात
हम्म,
है ना, कोई दिक्कत नहीं ना?
नहीं भैया एकदम राहत है।
ठीक, कुछ रहेगा तो
ठीक,
बता।
ठीक है।
Okay, so what was the learning? Other remedies which helped partially, it helped because it covered some symptoms, but it did not cover the pathology. Gastritis and stomach ulcer, that was the cause, which I was not able to find out and match with our remedy. Nair repertory, how to use Nair repertory, you can learn from this. And last, very important is Matra Medica. I've always been saying you have to read your Matra Medica and you have to match. The bold and the italics in the Matra Medica, Allen's and Boric especially, has to match whatever symptoms you want to prescribe on. Deeper you go, you need more things written in Boric and Allen's, underline, italics, and bold. Remember that. So this was just a short case. I just felt like sharing with you, and I'll be posting very small cases, learning from my practice so that we can focus on techniques of prescribing and learn from there more. The purpose is to stimulate your brain so that you go and you start finding these things. You get some insights and you start finding new things. There is a huge secrets. There is, what do you say, nuggets. A lot of things are hidden. Gems are hidden in our repertories, in our mathematics. It is our duty to go and find them. Thank you very much. Bye bye.